In video 2, we will look at healing with PEMF, the different healing factors, but we first look at some of the precautions and cares that it would really be important that you know about. Especially the stronger the device that you use, the more care you have to give. Now, first of all, best practice, you do not treat disease. See, you will never get into trouble for boosting health. If you say, hey, I'm helping you to increase your oxygen uptake and to detoxify and to give you more life energy, then that's nothing wrong. Every wellness center, every beauty salon, everybody does that. And there is no legal problems with that. But if you say, I treat depression, I treat cancer, then that's a serious issue. So you don't have a license to do that. And we live in very regulated times, so don't do that. Say you do not treat disease, but you promote health in the best possible ways. And if somebody comes to you who has 50 to 80 years of damage and has multiple overlaying degenerative diseases, you can't promise treatment in one day and then it's all gone. It's an ongoing process. And that's why many of our clients have a device at home so that they can use it daily or every second day. And through that, over time, regenerate all the organs, activate everything, and increase the healing practice. So it's something that you shouldn't make any false promises. It's not a miracle cure. And just to be certain about that. Now, in regards to precautions, there is not a lot that you need to be aware of. Everything electronic, hearing aids, key rings, credit cards, everything, mobile phones, little dictaphones. You know, people have those in their pocket and they don't think about it. And then they sit down and have treatment. And if you look at this image, you can see now there is a big spark going around this chain. This is a metal chain. So if you have a treatment like that, it wouldn't harm you. It doesn't hurt. See, he doesn't even feel those sparks at his hand, but it's pretty scary. We had a girl with nose studs, and there was a spark flying from that nose stud to the ring, and she was kind of freaking out at first, and then she wanted us to take pictures. But it is something that can scare someone. So it doesn't harm, but it is welding the metal together. So when you do it long enough, that metal chain is absolute rigid afterwards. So if you do that and you have a pacemaker, you have hearing aids, or you have stents, or you have those clips after heart surgery, you know, those clips for bypass surgery, then that can be quite dangerous. Don't do it. Just in case of such a client, ask the practitioner, get permission of the doctor, explain what you want to do, and then have a legal backup. Otherwise, just deny the treatment. It's a lot safer, especially pacemakers. You don't want them to stop. If a hearing aid stops, they are up to $6,000, $7,000, $8,000. So that's nothing you want to just fry with your electronics. And also stay away from your computer, stay away from your mobile phones. They can get damaged, especially with a strong device. Necklaces, as I said before, they can throw sparks, but they won't get any harm, and you won't even feel the spark. So don't worry if that happens. Just better you take everything into a basket up front, have your Weber on the wall, give clear instructions to your clients when they come so that you don't cause any damage. And that brings us to treatments. Now, pain. Very, very simple and logical how it works. When you're awake, you have pain. Toothache, nerve pain, healing pain, whatever. When you go to bed, usually that pain increases at first when you relax because you have more focus on it. During alpha state, in that relaxed state, you feel more. But then you switch into theta state, and that's when pain is switched off. And that's when you fall asleep. Normally, deep sleep, theta level, does not feel any kind of pain. And it's a natural reaction of your body. In order for you to heal, you need to sleep. And in order to sleep, your body needs to shut off pain that prevents sleep. So it's a natural mechanism. And theta level and delta level, you're free of pain. So what we do is we simulate the frequency. Theta is at 5 hertz, and if you go down to delta, that's 2, 3, 4 hertz. So what we do is we set the PEMF device, the oscillating device, to that low frequency. And what we know is that 2 hertz is nerve regeneration, nerve repair. That's when you don't think, and then your nerves can get repaired. When you don't stress, your nerves can repair. So you need to go into those deep sleep phases, into those complete relaxation phases for your body to heal. And that's what you create when you create that low frequency with your PEMF device. As soon as you go into 7, between 5 and 9 hertz is tendon and bone ligament healing. So what you would do is, if you have osteoporosis, you go into those low frequencies around that range, but that's where you feel pain again. So often we combine the treatment and start from 4 going up to about 10 hertz, and that's the phase where you then do treatment or bone treatment. And it's fascinating when you have a treatment in the right frequency for about 10-15 minutes and your body starts to fall into that theta state, how all the pain fades away. Now this is a little bit of a training. It won't happen straight away. It's not like you switch on the device and the pain is gone, like a pain pill which numbs all of your receptors. It's a relaxation device which takes you into that relaxed deep frequency state where then your nerves can heal, where your bones can heal, and where the pain is turned off. Now, as you wake up again or you get out of that state, you will feel the pain back. And that's why it's a learning curve. Einstein was actually using the theta state, and every monk and every advanced practitioner of meditation, they try to go consciously with their mind into a very calm and quiet theta state while being conscious. So as you learn, you can use this to relax and to bring yourself into that complete quiet state and then maintain that as long as you can while you move around. It's possible, but it's a learning curve and it won't happen overnight. I've been actually working on that for a while now just to learn it and to see how long I can maintain a theta level. And it works quite fast. Within a week or 2, you can prepare yourself into that deep relaxation state, mind calming state, and then carry that for quite a long time. The next effect that PEMF has is detoxification. It's actually quite powerful. We've done a lot of different exercises where we combine PEMF with different types of detox treatments. We've done detox with sauna treatment and PEMF, detox with supplementation and PEMF, detox with clay, edible clay and external clay like clay bath and poultices for detox. And the results are really outstanding. And you can see this here on this map. We've started, and I have a blog post where you can see that, where we start with quite high levels, and after 6 weeks, they have all come back into the yellow. They have drastically reduced. And 6 weeks is no time. Usually you say for a serious heavy metal detox up to 2 years. So expediting the process in that form is really wonderful, especially especially if you are very toxic. During our workshops, we do these toxic tests all the time. So a lot of clients, when they attend our workshop, we see they have 2-3 of those bars in the red. Very, very high levels of silver, mercury, or cadmium, or lead, or arsenic, which is quite scary when you see that. And when they start going on to that clay treatment or detox treatment, it still takes a long time. But when they use PEMF at the same time and they shake their cells, they vibrate their cells, this process is highly expedited. And I can tell you why. It's pretty simple. You have a cell membrane. If you see the membrane, the cell, it's always shown as a double line. And when you look at that lipid profile that prevents outside plasma from the inner core and the nuclei of the cell, this membrane has lots of little channels. Sodium channel, ion channel, potassium channel. You know, there is all the oxygen going in, carbon dioxide going out, water going in. It's like, and glucose channels for energy. This is like a transport membrane which lets good things in and waste products out. Now, over time, those heavy metals, xenoestrogens, plastic, chemicals, medication, all of that blocks those receptors. And we know, for example, mercury is an antagonist, or is exactly the same receptor sites, uses the same receptor sites, same channels as zinc and selenium. So your cells won't get zinc and selenium if the receptor is blocked, or you have a copper zinc blockage, which means copper is blocking the receptor site and zinc can't get into the cell. There is many chemical pathways that are blocked by heavy metals. So when they're blocked and they're stuck up, your cell slowly deteriorates. It can't get the nutrient, it loses energy, and it deflates. And that's what we then call is a 30 millivolt cell, a very low energy cell, and they don't work properly anymore, they don't divide properly anymore, they don't build healthy DNA anymore. You know, they start being inflamed, and inflammatory process sets up, there is too much lactic acid build up, and that's actually then the start how a cell slowly turns into a cancer cell. That's what we call redifferentiation, or when they start to slowly deteriorate into a cancer cell. So as soon as you start using PEMF now, and you energize the cell, you vibrate the cell, and let's say it's a red blood cell, which resonates on about 17 to 22 hertz. Now you bring that frequency in and you resonate your cells, all of a sudden they energize, they blow up, and they throw out all of those little particles into the plasma. All of the heavy metals are flushed out. Now that's really great, because all of a sudden your cells can take up nutrients, they can take up oxygen, they function well, but now you have all those toxins floating in your plasma. And that brings me to the next precaution. And I really would like you to understand that properly. Don't just use PEMF and think, oh, now I'm going to detox. Those toxins are just washed out from one place, and now they circulate through the plasma and look for another place to block up again. So what you need to do is you need to bind those toxins. And binding them means you put chelators in your gut, you put chelators in your blood, you put chelators in your whole body system so that they bind to the toxins all the time. So when you flush them out, they cannot be reabsorbed and block another channel in another cell, that they're actually taken out of the body via your stool, your urine, or through the skin. And that's where we use clay, for example, edible clay. If you look at our blog post, you can see here this lady, beautiful, covered with clay. That's one of the treatments that we do, and we have a blog post that explains how to do that and how we add supplementation and everything to increase the results. Edible clay for internal, external clay bath, like laying in a mud bath to pull it out externally. Really fantastic. Zeolite. A very powerful way. You can use the zeolite spray, you can use the zeolite capsules, you can use zeolite in a bathtub. It binds to heavy metals and it helps with detoxification. Far infrared sauna and hypothermia, very powerful. Far infrared sauna will make you sweat a lot more, so you will release a lot of toxins, but hypothermia increases your body core temperature, so you really get to those deep tissue detoxification in a massive way. Some doctors in Germany said, Marcus, we don't need to do anything else. If we do once a week hypothermia, twice a week hypothermia, and we get the client into really high temperature and they sweat up to 2 liters, they detoxify so well that we don't need a lot more. So hypothermia is certainly a very, very powerful treatment to get rid of those toxins instead of reabsorbing them. And kidneys, as I said, so you chlorella, garlic, there is hundreds of them. Modified citrus pectin binds perfectly to cancer, to heavy metals. Plus, it's actually a treatment for cancer. So activated charcoal, plenty more. You need to get rid of toxins. So when you feel slightly nauseated after treatment, when you feel slightly irritated, when you have headaches, everything that would show that you have a detox reaction, prime the body first. And I'm going to blow this up and show you, bring it to front so that you can see it. This is actually your gut. Now you can see this is your esophagus, your stomach, and then here starts the small intestine. Now, when you throw out all those toxins out of your cells into your bloodstream, they're filtered out by the liver. The liver filters all of your blood. So as they are filtered out, they are transformed in the liver into water solubles, and then they go out through that bile duct, and as you can see, the bile duct ends up right after your stomach, in the beginning of the small intestine. Now, what is your intestines designed to do? To absorb nutrients. So as it goes through your small intestine and then through the colon, most of it is reabsorbed. And that's why detoxification without priming your gut properly doesn't work. Edible clay is a beautiful thing that you can have in the morning. I call it my latte, my mochaccino. It doesn't taste as nice, but it's something that puts that clay into your gut, and the lining will help with healing, helps with reduction of parasites, and it absorbs or binds heavy metals. And you can do fiber and clay and chlorella and all of that, and then prime. And then when you do a PEMF treatment and you throw out all those toxins into your system, that they're actually really eliminated and not reabsorbed. Now let me reduce that again. I really love those charts because they make it so much more clear on how our body works, and it's easier to understand. Kidneys in the same way. Kidneys will filter out and then through the urine. You can do that with your naturopath or health practitioner or doctor, DMPS or EDTA, chelation therapies to bind those toxins and then to urinate them out. There's plenty of ways, but PEMF will help you to rattle them free. There was actually a clinical study, and it's on PubMed, we have it on our website, where they activated detoxification with PEMF, and the chelating process, medical, clinical chelation process, was greatly enhanced by PEMF. So it's a beautiful combination if you have heavy metal toxicity. The next subject is oxygenation. And you remember what I said to you before, when somebody comes to you, you do not treat disease, you promote health. Well, detoxification is not a treatment of disease, it's promoting health. You clean out your body from toxins. And in the same way, oxygenation is not a treatment against a disease, but it helps you to heal the body drastically. So when you have clotted up blood, coin rolls, and high coagulation factor in the blood, liver stress, highly compressed white blood cells, which are more or less immobile, not even defined properly, and you energize them with PEMF, within 5 minutes, 10 minutes of a treatment, they blow up. Your white blood cells get triple the size of a red blood cell, and your red blood cells bounce off each other like billiard balls, like ping pong balls. They're full on energized. Their membrane potential is brought from whatever they were here, about 20, 30 millivolts up to 80 millivolt. And then they can carry oxygen. All their receptor sites, all their ion and potassium and oxygen channels are cleaned up. And through that, the cell can take in your lungs, where the vibration from PEMF will help with oxygen uptake, huge amounts of oxygen, and then it carries throughout the body. We know cancer doesn't like oxygen, so it's a very good treatment. When you just sit and breathe and you sit still, we know it doesn't work. If you do Ardenne treatment, which is breathing oxygen while doing exercise on a treadmill or on one of those running boards, then that's a lot better. But if you use PEMF first and then you breathe oxygen, your whole body can absorb it and take it up. In the same way, we use hyperbaric oxygen, but we prime the body first with PEMF so that all the oxygen can actually taken into the cell instead of into just the plasma, and none of your cells is ready to absorb. And we have also singlet oxygen. This is actually quite an interesting concept. It takes your room oxygen, your room air, and it excites that in a magnetic and light field. So there is different lights and magnetic field in here, and as the air is blown through here, it starts to create singlet oxygen. It's actually 3 oxygen molecules, and it's full on active. And as soon as you release that into the room, it's similar to having fresh air, oxygen after lightning, after thunderstorm, after full on at the ocean. So the uptake of singlet oxygen into the body is greatly enhanced. And this is a tiny little device that you can put beside your bed and just breathe in that energized, excited oxygen, and it will help to for your cells to take up oxygen quite well. For those of you who haven't seen this video, it's actually Gladys in England having a treatment, and she had PEMF treatment at the Arcadia Clinic, and we see the blood before and after, and the effect it had in a matter of 15 minutes or 10 minutes after the treatment. She was like fully recharged and fully activated, and that's something we want. So oxygenation was number 2. Number 3 is nutrification, and it's pretty obvious. When you have all your cell membrane channels blocked by toxins, by plastics, by medication, by everything that blocks those channels, and you start vibrating those cells really heavily, and again I said you need quite an excited or intense energy of 500 Gauss and above. That's why all the clinics use. Dr. Dowers in Bad Aibling has 3 of those chairs with 1000 Gauss. Dr. Herzog in Eppenheim, all of the clinics we've been to use in order to receive or achieve those high results, very intense machines. When you hold the magnet in those machines, they vibrate like crazy. 500 up to 2000 Gauss in those oscillating machines. And as soon as they do, the cells get so cleared up and all the channels work that all of a sudden the nutrient uptake is drastically increased. And you can see that when you have clients come in and their iodine level and their zinc level and their nutrient level are so low that they're in the red, that their cells can't function. You know, like this alone can be a cause of cancer. This alone can be a cause of complete immune deficiency. So taking that up and starting to shake loose all of those toxins, and this is what you see here in this chart, very high mercury and very high cadmium and high silver. This is really a dangerous combination. Now that creates a zinc and copper block. That creates an iodine deficiency, because iodine is used up in order to detoxify mercury. So when mercury is so high, then that body is totally depleted of iodine. And then you have also here, zinc or selenium deficiency. So selenium, again, is a high chelating factor for heavy metals. As soon as we started using PEMF and we started to supplement and increase with iodine, and we increased with selenium and zinc, the whole body started to recover, toxic levels went down straight away, and the body healed. And this is what we call healing. Nutrification massively increased. When you look at clients that go for IV treatments and they're not energized before they do so, all that nutrient factor is just in the plasma. It's not absorbed into the cell where it's needed for energy production and for nutrification. And then it's filtered out. It's actually causing a lot of stress to your kidneys and to your liver because it's not absorbed by your cells. And that's why using PEMF before you do IV treatments, nutrient treatments, before you do B complex infusions, all of that is greatly enhanced with PEMF. And that brings me to activation. You remember that was the last one? It's pretty evident. If you add nutrients, if you add oxygen, and you reduce toxins, what happens automatically? Your energy production in each cell is massively increased. You feel like completely built up and energized again. And that's what we've noticed. We actually had beautiful feedback from retirement villages where the nurse called and said, Marcus, we have now different problems than we had before. Since we have the device, we have increased libido, we have parties and dancing in the hallways, we have late nights and they don't go to bed, and the pain reduction makes a huge difference. So there is an increased energy level with PEMF, and you will notice that animals love that. We have several dogs that are treated, actually vets, a lot of vets use those treatments for animals after surgery, after treatment, if they have hip problems, if they have joint problems, if they have, like us, any kind of deterioration, and you use PEMF, animals love it. They actually nudge you with the nose and then go to the device and tell you to turn it on. In horse treatments, it's even more so. You will find that a lot of horses, when you come with the strong PEMF, I was actually scared. I thought, they can kick and they can bite. Look at those teeth. It's kind of scary, but they love the device. They hold, they lift up their leg. I first thought they were kicking, but then you could feel it was actually just trying to get to the right space where it was helping most. So animals are very, very receptive and they love the device. There is no racehorse in this world which is not treated with PEMF, because that's where it actually came from, to increase their bone density, to strengthen their tendons, to increase the muscle flow, and to keep all those very fragile areas like the sacral area healthy and active. So it's a combination that you can use for yourself, for your pets, for your animals, and have a nice relaxation time on it, and it really activates you. I have clients that travel. If they come to a workshop with me, and you will all find they unpack during the workshop their device, plug it into the wall, and then they recharge during or after jet lag or wherever they come from. It's something you don't want to miss once you're used. And this is one of the questions that we always have. Is there any kind of negative side effect? Well, let's say it that way. Addiction is certainly something that you don't want. But if you feel so much more powerful, so much more energized with that device than without, why would you not want to be addicted to it? It's like being out in nature. You all know you go on holiday and you feel so much better than when you spend your time always. So who wouldn't want to go all time on holiday and spend lots of time outdoor and at the beach? And that's the effect that you get from PEMF. Otherwise, there is no negative side effects, no reason to worry, no problem. You can't overdo it. You can't have too much of it. It's actually deflated when you use it and your cells are recharged and they don't need any more. They just deflate the energy. It's just given on and passed through without causing any kind of damage. And it's pretty logical when you think of where it comes from. It's our natural energy field from the earth. And if you have it, your cells are active. If you don't have it, your cells are deflated. So there's not really any kind of negative side effect that has been observed or known to us. And we'll see you in the next video, where we now use those healing attributes for different types of diseases.